Hello, everybody. Welcome to today's webinar. I'm Dr. Jeff Soloway. I'm the co-founder and chief training director at MindWell-U. MindWell-U is an organization bringing evidence-based mindfulness training to organizations, and with the mission of helping to make mindfulness more relevant and accessible for all people. We've had the opportunity of working with tens of thousands of employees across Canada and the US, and helping to build resilience in mental health. And we're thrilled today to have an expert in the area of mental health strategy, Dr. Marie-Hélène Pelletier, and she's going to talk to us about how we can both start this process and continue or grow this process of mental health strategy in your organization. Really excited that we've had such a wonderful response to this webinar. We've had over 400 people register. And what we're going to do is, at the completion of our webinar today, we're going to send you a link for a recording of today's webinar. So you'll be able to review it if you like. You'll be able to share it with other people after in your office. And also, anybody who registered for today's webinar is going to be able to take our 30-day mindfulness challenge for free. So you're going to be receiving an email from us tomorrow with a link that will get you a recording of the webinar, as well as an opportunity to register for the 30-day mindfulness challenge. And the 30-day mindfulness challenge is the core training that MindWell-U provides to organizations in helping to build mental health and resilience in their organization. As I mentioned, today's webinar is on how a mental health strategy will pay dividends in 2018. And before I introduce our esteemed speaker, I just want to run through a few housekeeping items. As we go through our conversation today, there's going to be a few different polls that may pop up onto your screen. So if they pop up, they're just questions that we're trying to get some feedback on. It helps to facilitate the conversation. If you can answer the questions, that's great. If you don't want to, you can just simply close the box. And really important that if you have a question that arises for our speaker or myself as we go through the conversation, please put it in the chat window. And I'm going to do my best to raise that question to Marie-Hélène as we go through. As well, if it doesn't fit in the midst of our conversation, I will save time toward the end of the webinar where we will ask those questions and respond to them. So please, we try and make it as interactive as possible. So if you have questions that are specific to you and your organization, please put them forward, because they're going to be relevant to other people. I think that's about it. I'm really delighted to have Marie-Hélène Pelletier to speak to us. Mental health is top of mind for so many employers, but where do we start? How do we get support? And these are really serious questions, and not everybody knows how to do it. And so we've gone to the best in order to get these answers. Dr. Marie-Hélène Pelletier is an expert in workplace mental health. She has worked with many organizations and individuals to improve their overall health, including their mental health. She's been a practicing psychologist with over 20 years experience in clinical counseling, workplace insurance. She holds a PhD in counseling psychology from UBC and an MBA from the UBC Sauder School of Business. So we're really grateful that Marie-Hélène joined us today. Welcome, Marie-Hélène. Thank you so much for joining us.
Thanks, Jeff. Happy to be here.
Let's jump right into it and get your perspective on, why do organizations need a mental health strategy? Why now?
Yeah. And it's a great question, and many components to this question. I think the first one is, why are we looking at mental health? We need to think about health in its broader sense. Traditionally, a lot of organizations have thought about health in the physical health type way, which makes great sense. And in the recent years, we've been adding mental health, and we're also adding financial health. So really these three pillars, and there are many others really, but if we were to start with the main three, I would start with physical, mental, and financial health. And so it's important to think about them together. And I'll get to mental health specifically, but it's important to start there because these three areas of our health impact each other, right? They're all related. We know that from makes sense to most people, but it also is established in the academic literature. So whatever we do to help with one area of health is going to have positive impact very likely on others. Another good reason to think about all three areas of health at the same time is that not only they interact with each other, but whatever we do to help these areas will also impact other areas, and sometimes more than one. So for example, and we'll talk about mindfulness later today, it hits more than one area of health in a very positive way. And then finally, another very practical reason why looking at all areas of health together makes sense is that most organizations will have some beginning of structure related to physical health. And if we're able to incorporate and tie with this, then mental health is not going at it on its own. So first, need to look at all three areas of health together. Second, why do we need a strategy? And really, what usually happens is organizations have goals. They want healthy workforce for all the good reasons that exist there. And so if we have this goal and all we do is apply programs, we're at risk of doing what sometimes and I'm sure you've heard this, the random acts of wellness, where it's good, it's all happening, but it's not necessarily moving the organization in the direction they want. And that's what a strategy does, right? It provides that path within which there will be, sorry, I got distracted with the poll, but it's a good idea to ask the poll now. So it provides the path, basically. So let's do that poll now. So the poll says, does your organization have a mental health strategy, as far as you know? Yes, no, don't know. So let's see what perhaps the group is saying there.
And feel free, you can continue to chat, and people will okay. Respond to it, and we'll get the results.
You'll tell us what you find. Okay, very nice, thank you. So just continuing though on why the importance of having a mental health strategy. And some of the things here, I know that some people on the call are from larger organizations. So you've seen this, some of this, and some are from smaller organizations. And I guess I've actually seen in either large or small organizations, some individuals not necessarily aware, but there is, wait a second, I need to minimize this too. Okay, so another reason to have a mental health strategy, few pieces there. One is we're seeing in most organizations an increasing rate of mental health challenges. And that leads to all kinds of things. We'll talk about measures, but it can lead to absence, casual absence, can lead to short-term disability claims, long-term disability claims. And if we're looking, and there's been public information about rates of long-term disability rates for insurance carriers related to mental health. And that average right now is at 30%. That means 30% of all long-term disability claims in all organizations are for mental health first diagnostic. And that means this is an average. This means for some organizations it's at 20, and for some organizations it's at 60. Right? So there is that range. It's not everyone's hovering around 30. So it's fairly significant, especially for some organizations. The other reason why it is important is the Mental Health Commission of Canada issued the National Standard on Psychological Health and Safety in the Workplace in 2013. And we'll talk about the factors a bit later. But basically, this standard has put mental health on the map of all Canadians in many areas, but certainly of employers in a very significant way. And there is great research to show the positive impacts of taking care of mental health. Just a few more points still, if I can, because it's broad and there are many great aspects, and not all these things will speak to each organization in the same way, but another one are generations in our workplace. Most organizations will have millennials as at least 50% of their employee population by 2020, which is right around the corner. That's a generation that has characteristics that are different from other generations. We actually know that from research. But one of the things is that they value health and they value balance. And as they become a majority in our workplaces, that's a population to make sure we pay attention to. And that's not the only generation. We also have an aging workforce, right? Individuals staying even longer in the workplace. And these people too will need even more attention to their health. So that's another one. And of course, there is the social responsibility. It's always a good reason to do this. But also the other piece I would add now in 2018 that's been there for those organizations that have already been on the path is that many organizations are realizing that they need to either in addition or take a different direction. In addition to their broad brush, perhaps, approach, they need to look at more specific more specific actions, more specific groups within their organizations. And it ties to this increased interest in data analytics and measurement and all this. And the more you're specific, the more you can actually get to this. So that's an additional key component. I'll pause there. I know, long answer.
Well, no, thank you. It really gets us started in a good way. And I appreciate that statistic that you shared, around 30% of long-term disability. Average is around diagnostic around mental health. So that's very interesting, and that's driving things. And that will get into our kind of next question, I think, around building a business case. But before we go there, I just wanted to revisit that poll question, because we saw about 44% answered yes, they do have a mental health strategy, 36% said no, and then about 20 said not sure, unsure. Does that surprise you? Is that what kind of statistics are you seeing in organizations currently?
It's fairly consistent, and I'll point everyone to very, very good research that's been done on Canadian employers. Research has been done by the Conference Board of Canada over the past, I would say, 2 or 3 years. They published a series report. There are 4 reports, and these reports are called Healthy Brains. And it's basically looking at the mental health of Canadians in Canadian workplaces. So it's useful, I think, for anyone, really, but certainly it's research being done in Canada. So if you're a Canadian employer, often that's interesting to be able to compare to similar. And now this research, things move really quickly in the area of mental health, right? So but what we were able to see in these numbers, even those that were published last year or the year before, is along the lines of what this group is reporting. I would say this group is a bit higher than what you'll see in these reports, but that's what you would expect, really. So makes sense.
Okay, interesting. And you mentioned the Mental Health Commission of Canada, and we've had real great pleasure of working pretty closely with them over the past 2 years. They've been really supportive of our work. They've implemented the 30-day mindfulness challenge.
As an employer themselves?
Yeah, to their organization. They've promoted it to their audience and stakeholders. And we've done a number of different webinars with them. We did a different mental health 2-series webinar with them in the fall. So they've been great partners to us over the past couple of years.
I'm not surprised. I mean, I'll just a quick comment, and it is useful, I think, for all of us as we're putting our employer's hat and whatever our role is. In fact, we could ask the audience what roles do we have on the call as well. But what I wanted to say is this is a perfect example. Number one, it's very normal for the Mental Health Commission because they do a number of things right, but this is walking the talk, right? So the Mental Health Commission's dealing with the mental health of Canadians, but they're taking care of their own mental health as an organization. So it's good to see. Mm-hmm. Did you want to do that poll to ask?
Sure. Well, we'll get that poll asking about their role. And while we do get some of that data about that, I'll ask you about what are some of the key elements for building a business case for a mental health strategy in your workplace? Because no doubt there are people on the call who are interested in it, but might not have that awareness of what's important, how to bring it to their managers and build a case for it.
For sure. Yes. And it's interesting. It's as if sometimes, and I see that less now than perhaps I did a couple of years ago, but it's still there sometimes, especially if you're either newer in your role and that's part of the expectations for you perhaps, or that's the first time you get around to looking at mental health in your workplace. Often the first reaction of people is like, oh my God, I'm not an expert in mental health. I don't know where to start, kind of thing, even when looking at business case. And what I remind people then is a couple of things. Number one, a business case is a business case. And in this case, no one's asking you to be an expert in this area, just like you may not be in other areas either, but you can follow a similar process. And in fact, what I often suggest is that you look at how business cases are built within your organization. If there is a template or a way that people like to do it, I would say start there, right? Because it's a conversation that will be easier already. Sorry, you just need to move the poll so I can see you. Sorry, I got distracted now. Yes, so follow whatever process you have in your organization. That's my first recommendation. Okay. So in the absence of that, or as you're adding to whatever you find, a key component will be to look at data from your organization. right? So you want to work with your partners, your employee and family assistance program, if you have one, your insurance carrier, to get data from them in terms of what's going on in your short-term disability claims and your long-term disability claims. Are you able to get information about first diagnostic? Second diagnostic is important as well. There's a lot of conditions that bring people on disability sometimes will be physical as a first diagnostic, but then there will be a secondary one related to mental health as well. So you want to dig into that rich data. You want to look at casual absences. If your employer, or if as an employer, you're doing an engagement survey that goes in, turnover rates, any data you have about your employee population will be an important component of that business case. You could incorporate elements more from a legal perspective and bring in elements from the Mental Health Commission of Canada, the national standard, which in many ways for employers has become a legal imperative. So it's not an obligation, but it's something that people pay attention to. So worth bringing forward. The financial aspect we mentioned, sometimes it's worth bringing the moral aspect and even intangible benefits that you expect will be there for your organization. Sometimes it can even be things like, it will allow us to avoid damage that if we did nothing, it would be associated with our organization. So some of these are key elements there. I'll pause there. Sorry, keep going.
Okay. Well, you asked about the poll about people's roles on the call, and so we've got some more stats there. We've got 32% human resource professionals, 13% senior leaders, 15% managers, 27% employees, and other 14%. So a nice,
very nice,
diverse group. And I wonder, my guess is that everybody in an organization plays a role in a mental health strategy. And maybe you can speak to that and what role these different individuals in the different roles they can play.
Yes, and even see the composition of this audience is different from what we would have seen 3 years ago. And it's fantastic. It is better than what we would have seen a few years ago because we've got a spread. A few years ago, we would have had almost a large majority of HR people and quite possibly a smaller audience as well. Although, given the mindfulness link, maybe it would have been large. But from a mental health strategy perspective, we would have had a smaller audience and more from HR people. So what we're seeing is and it is in large part, I would say, in Canada due to the Mental Health Commission of Canada, but there's been way more dialogue, way more conversations everywhere related to mental health, which means it's on many more people's radar. So we're seeing this, and it's very good. In terms of roles, I would say this is an area where every one of us, no matter what our formal role in our organization or what we do in our lives is, we can play a leadership role there. And if we look specifically in the workplace, there's a role for everybody. In fact, not only it's good for everyone to play a role, it's critical. And I'll tell you one of the reasons why the employees specifically play a very, very specific role. One of the things that, sometimes people ask about research on, what do we know about the return on investing in, say, a mental health strategy or in wellness prevention activities. And it's really important, and all the measurement is very important. But one of the things that we've seen from applied research, so when researchers actually not only do look at one specific intervention in the context of a purified research, but when they go in actual workplaces and try to look at the impact of, say, wellness activities over a period of years, they have lots of challenges. And one of the key challenges is that people change in organizations. Right? So you may have had really good buy-in from, say, leadership year one, and then it influences the culture and everything, but that changes over time. This person goes, and then things are not going on in the same, with the same energy and level of involvement. One of the things we know is that organizations that not only have had leaders take an active role there, but also have had employees get involved. Employees involved in, say, in being invited to share what they do to care for their mental health, being involved in committees, being involved in these activities, then this makes the whole organization carry the commitment to mental health. So that's just a small example in which it's not just a nice, oh yeah, everyone has a role. Everyone absolutely has a role. We have to all pull in.
Right, and maybe we'll see that a bit further explained when we start to look at some of those factors that are outlined, because they're quite comprehensive. We've had a couple questions arise, and
okay.
and really encourage people who are on the call to put forward questions, specific questions that you have that are relevant to you and your organization, because it helps to kind of always ground the conversation. So please feel free. And this is kind of just a real specific one. And welcome, Linda. Thank you for joining us today. Wondering if you can provide some information about some specifics about what a mental health strategy would include.
Yes. So for example, actually, let's start. One of the great places to start is to look at that national standard from the Mental Health Commission of Canada. So can I ask you, Jeff, to put up these 13 factors, because not everyone is aware of those. And just for those of you for whom this is perhaps newer, you just look up Mental Health Commission of Canada, mhcc.ca, and you'll find the 13 factors, 1-3, which are basically things that will help you look at your organization and how you're doing on those 13 factors, and then decide what needs to happen next. So just to give you an idea, are you able to show them, Jeff? Or
yeah, I apologize. I had a hiccup there for a second, but
okay, don't worry about it. So, but just to continue the conversation, right? So the Mental Health Commission of Canada created this standard. It's all based on research, and basically, now we have them. That's great, thank you. Identified those 13 factors that would be, if they are present in your workplace, are good signs of psychological health and safety. So I won't go through all this, obviously, but things like a healthy organizational culture, civility and respect in the workplace, psychological demands, growth and development. So all of these areas have been listed as key things that if you are taking actions on all of them, you will likely have a psychologically healthy workplace. So a good place to start in building your mental health strategy is that, so a couple of things. Number one, I would say you want to, and you don't have to, but there are organizations that are not even in Canada that are using these as guidelines, because they make sense, they're research-based, and they're easy to work with. But basically, you first want to look at those 13 factors and how you're doing as you compare your organization to them. And I'll give you 2 ways in which you can do this, because you're like, but even then, where do I start, right? So I'll give you 2 tools. If you have 3 minutes, so you don't have that much time, you're a small organization, you don't want to be overwhelmed, but you want to get a sense of where you're at, you can, and we could send links to these tools after if we want, but one that's called Minds Matter. It's a brief tool that's been developed by Civic Action. That's a group in Toronto, in the GTHA, that's looking to improve mental health in all employers in that area, but they made the tool available to everybody. It literally takes 3 minutes to complete it. Anyone in the organization can do it. It costs nothing. And it gives you recommendations on what you could do next to get closer to that standard. So that's one way. What you could also do is look at an audit tool from the Mental Health Commission of Canada that is way more detailed. So if you've already taken steps perhaps in this area, that will help you figure out where you're at. So in the beauty is that most of the time, organizations are already doing things in the area of workplace mental health. They don't even realize it, but they are. And that's actually a very positive experience, because you realize, wait a second, I've been doing a few things, okay. And if I were to take the next action, oh yeah, here's the gap that I have not paid as much attention to. So it will point you towards these directions. So I use that as a guide. I think this is a good one. You don't need to reinvent that wheel, it's there. But you want to pair what you find there with what your organization's strategy is, the business strategy. Which business are you in? What's your strategy there? What are you trying to achieve? And when you're going to look at the mental health in your workplace, your business strategy, you're going to bring all this together and say, okay, what do we want, therefore, based on all these observations, these directions? And so perhaps then you're going to say, well, we want, I'm going to invent right now, but just for example, we're going to say, wow, we realize we've been doing a few things, but we really have not been that proactive in bringing programs to our employees. We have not been that proactive in sharing information about mental health, sharing our commitment as a culture to mental health, for example. And so that can become a pillar of your strategy, more communications about mental health. And then you'll put programs in there. There could be another pillar that says bring more research-based, evidence-based, solid programs to our employee population that they can take in their hands and use for their own personal life, like mindfulness, for example. So these are some examples, but it's just like any business strategy, really. Your strength is going to be in creating one that's very specific to your organization. And even sometimes, I've seen this, sometimes, depending, if you are a very large organization, you may have a high-level strategy, and you may need to have sub-strategies, I'll call it that way, for specific areas. For example, large organization may have a call center team here, and they may have other teams over here that have very different workplace experiences, right? And therefore, what you need may be different.
I hear you in terms of, I think it's a great suggestion in taking an analysis of what you already have in place and showing that and looking at some of the gap areas. And what about for individuals who are working in, tough environments where they're trying to bring this forward, but the bottom line is going to determine what's going to get attention in terms of, showing the return on investment. People care about it. Is this going to save my organization money? And this is what they're hearing back from their managers and their leaders if they want this to move forward. So what are you going to say in response to these people? How can they start to show those types of returns?
Yes. I think I've heard others say this before. Sometimes you need to be sneaky, and you're going to need to create ways to enter this situation. Because in a situation that's perhaps like this, taken to the extreme, it's actually not possible to get started on working on a strategy in a situation like this. In a situation like this, what has often worked is to not follow my earlier advice to start with strategy, and instead to actually start with programming. To start with a few things, not because it's going to get you to the big results, but it's going to get you in the door. You're going to have people listen. And that's how it can happen. So, for example, one of the ways so at least two things come to mind. In terms of, if all that gets attention right now are really, my costs and how to minimize them, often it's a good idea to look at your numbers on short-term, long-term disability, because quite possibly the mental health claims are high there, and that's a good way to then say, wait a second, we do actually have numbers that suggest that we should pay attention to this, right? So that's often a good place to start. If that's not significant enough or not getting attention, another way is to then just start doing things. Small committee of a few people dedicated that get permission for things that are easy to do not cost any money, and get that done. I'll give you an example. An organization, recently a fairly large one, that actually happens to have a strategy, but this was part of what they did, and it's so lovely. What they did is they used one of those observance dates. So, World Mental Health Day, for example, or, Bell Stock is coming soon. But what they did in that organization is they had a committee, and basically, they used their existing structure of health and safety, so the physical stuff a bit more, but these structures exist, so you've got an in already, and often these people will be easier to rope in because they know that health is a bit broader than just physical. And what this organization did is they basically, for that specific observance date, they had greeters at each of the door of this employer's workplace, and they had different locations. So they had greeters that day that were greeting people with a smile, wishing them a great day, reminding them that this is, let's say, World's Mental Health Day, and inviting them to go on their website, their company website, to hear stories of what others have been doing to take care of their mental health, others in their organization. And they had there a few people who were sharing what they were doing to take care of their mental health, and they were inviting others to share their own new ones, and they did. So simple, didn't cost anything, but the feedback that this organization got was actually quite nice, right? And that was a way to get in. And feedback included things like people feeling that the organization cared for them, that they could care for each other, support each other, and actually got good ideas on how to take care of their mental health. So that's the way to do it.
So I'm hearing you say that, one step is look at short-term disability, long-term disability, and start to look at some of those numbers. And then you can also implement kind of like a pilot project, some type of a program that you can start to do some type of get some feedback, get some data on.
Exactly.
And that might be able to tie back to ROI and as a first step in launching a mental health strategy before going.
Sometimes you need to do this. Yeah. If you had both options, I would say if it is possible to start with a strategy, I would say yes, do that because it will pay off faster. But if you need to start where your environment will be will be willing to start. And Jeff, I'm wondering if you can give people an example, because mindfulness is something that most people have heard about, many people love already and want to hear more about. So that may be one of those examples. There could be others as well, but I know some of the work you do and I think it's fantastic. So I'm wondering if you could show, you were showing me, that sheet you were showing me earlier with the kinds of numbers an employer gets if, say, they do they implement one of your programs. Do you want to share that?
Sure. Yeah. I mean, I can share a little bit about that. So when we implement the 30-day mindfulness challenge within an organization, what we offer now is an annual license to the challenge, so that a company launches that across the whole organization, and they have a whole year to make that available to their employees, and they could offer it as a leadership development opportunity, as a mental health strategy, wellness, return to work, team building. There's a lot of different ways one could market it or get it out to the population. And we have different data points that were integrated into the challenge so that people, when they go through the 30-day online training, they complete 2 surveys amidst the training. And then we collect that data and then we're able to give it back to the employer. So I can pull up a sample of what we call an HR dashboard. This is what I think you were referring to. And this is just a sample that I pulled up, and it shows you the number of employees that are going through the training. Everybody who takes the training gets to invite a buddy from outside of the organization, so they can invite anybody they want. And so we track the number of buddies that are invited too, and there's no charge to invite a buddy. And we ask them a bunch of questions as they go through. Is it improving their mental health? And you can see, 100% of people who completed the survey said that yes, it's improving their mental health. They're learning skills for the workplace, managing stress better, engaging better at work. 92% are focusing better. It's improving the way they manage conflict, improve physical health. So these are all the types of statistics that employers and HR professionals are able to gather and then take up the chain and show and demonstrate the value that the training is having on their employee population. And then as more cohorts, so this will tabulate and summate all the data from across the whole year. So it will grow. And that's the whole purpose of an annual license, because after the first group goes through it, you'll see the early adopters who are interested in mindfulness, but then they start talking about it. And then it's a water cooler conversation, and then a manager takes it on and they make it available for their team. And then it slowly grows like that. And then more and more people get involved, because we're trying to build towards a culture of mindfulness. It's a way of being and working with one another. And that doesn't happen overnight. It doesn't happen in 30 days. It takes time to get integrated into the way people talk and the way people interact in their everyday workplace lives. Is that...
That's fantastic. There's many things to love about this, but I think too that strike me. I know that employers love to see numbers, obviously, as they should. So it's a good thing. And I mean, these are numbers from their own employee populations. If as a workplace you're able to get some resource in, for example, like this one, critical that it has measurements. So whether it's this one or any other, you need measurements so you can go somewhere with them. But the other thing too that I think is fantastic about mindfulness is we've often talked about and need to continue talking about the stigma of mental health. It has decreased. It's not as big as it was, say, 10 years ago, but it's still there. And one of the beauties of mindfulness is that it's mainstream, right? You can talk about mindfulness. It's very easy to bring that forward. So especially if your organization, I mean, it's good for any organization, absolutely. But if you find that the level of comfort with mental health may be a bit harder, mindfulness is very easy to bring in.
Well, that's very interesting. And thanks for bringing up that point around the stigma. And we often talk about how there's been such a huge focus on reducing the stigma around mental health. And I think that there's a lot more awareness around mental health today. And now people are looking for strategies. They're looking for tools. We're kind of moving past that first stage. And now people are, they want the tools. They want the strategies. And mindfulness is such a core competency for positive mental health that it just makes sense to make it available. We make it available in public education today. We're teaching it to kindergartens. And the people in the workplace today maybe missed it in their primary education. And so it needs to get integrated into the workplace. We're seeing a lot of great questions come in. I'd love to get to some of them here.
Sure.
And here's an interesting question about someone who's been working on a committee trying to bring forward a mental health strategy. And then it seems like when it's time to move forward, leadership backs down and changes the direction. Is there any advice that you could provide to a committee member who's kind of constantly stuck in the planning phase?
Of course, we would need to talk, because there is, right, the next thing that comes to me is, well, tell me more about what contributed to changes in direction, right? Are these changes in priorities for the organization, changes in actual people? Hard to answer. Wait a second. But basically, if I go high level, what you're saying is you're trying to move things forward. At some point, there's an agreement, but then they don't do it. I guess what I would perhaps suggest is try to find out more about what makes it stop. What gets in the way? What is your barrier in this case, more specifically? And once you have that identified barrier, and I'm sure you're thinking, yes, I have it in my mind. Okay, so then look at how you can take the very first step. Let's say that barrier seems big. You're like, oh my God, well, here's my barrier. Break it down in, 100 steps and identify what your very first one could be. So it's going to be super small, way smaller than your initial readiness to go and implement, the mental health strategy. But at least it'll be something, and you'll perhaps get some movement. So that's one thing that comes to mind. Another thing that comes to mind is, and this one depends also on size of your organization, but sometimes you'll be able to pull in some of your partners. So if in your organization there is an employee and family assistance program, or if there is an insurance carrier, sometimes you'll be able to loop through someone in your organization that ties to these vendors and see if you could talk to them about their ideas about what you could do. The beauty there is that these individuals work already with your organization and want to help. Hopefully they should, and they may be able to give you even more specific than I can today. I give you some specific suggestions, and of course, otherwise you could also just go to a consultant and get some information there. So combination.
You mentioned barriers, and can you identify what are some common barriers that you've seen popping up for organizations on this journey of creating a mental health strategy? What are kind of like the top couple that come to mind?
Well, I don't have a list, but I'll tell you, I one of the good, sometimes a useful way to think about this is that size of employers and the context that you're in. But one word that comes to mind is scope. That's often a barrier, either because the organization is small, they have not done any of this yet, or it's big and therefore it's massive if we're going to do something. And so that seems just so big that then people freeze, just like any sometimes larger projects that we as individuals look at, right? So the scope seems too big. And so what needs to happen, what people need to remind themselves is, even if you see all the good reasons and all the good the ways this could be done, like perhaps even the person earlier who was asking, what do I do now? I almost hear the enthusiasm behind it. We still need to then scale it back to what could be a first step so that we move away from this scope that's too big that then paralyzes us, right? So to scale it down is very, very important. Another barrier, I mentioned it a bit earlier, is that people will get buy-in of whoever is there now in leadership, and then leadership changes. And therefore, one of the challenges is that the commitment goes away. And for this, I'm going to bring us back to an earlier part of our conversation and the importance of starting the movement from the ground so that more people are involved, so that a change here is not as impactful. We've spread the engagement, we've spread the efforts and the enthusiasm around it. So the buy-in is another one. Another roadblock I mentioned also earlier, but it's a key one to keep in mind, is this one's a bit more for larger organizations where you'll have different cultures, subcultures in different teams. And therefore the broad brush sometimes will work well for everyone, but sometimes it needs to be different. Sometimes we need to work with certain groups more than others because that's where more of our disability is, perhaps, or whatever, right? So we can do a combination of supporting everyone so that the healthier groups stay healthier and become even healthier, right? And at the same time, pay attention to where our groups that need most help are and do that. So that's a roadblock, as in, if you don't do that, then you're missing out an opportunity. Two more. Another one is, that's also one that goes into be specific, is to make sure, sometimes people go so broad brush or so recipe almost that it's not perceived as sincere from the employee population. And so taking the time to, when you're thinking about your strategy, what's going to go in it, to think about your organization, that culture, and what's going to resonate, what's going to be seen as sincere in terms of actions and programming. And then the last one is the last roadblock is, again, we've touched on this one, but it's to try to go at it alone. Big mistake. It is big, but not, even if you were able to take it all on, it's not a good idea. You already have partners that are also taking care of the mental health of your employees, like your employee and family assistance program and your insurance carrier, for example. You want to bring them in. Otherwise, you're going to be doing a silo strategy here, and it certainly won't be as efficient as if you would bring all your partners. So these are some examples I hear often.
Thank you. And it's important to hear them because I think it helps to normalize people's experience and move beyond
Not
it.
easy. Yes.
Yeah. We had an interesting question pop up, and I think it's relevant to, you were speaking about both short-term, long-term disability and working with different groups and supporting them. And the question is around presenteeism and how to measure presenteeism. And presenteeism is an interesting concept because it's, this notion of people who are at work, they're not off work, but they're not as productive, right? They're not as present and productive in their daily work as they could be, and they're losing productivity because of it. And that's, there's a lot of statistics saying that that's costing way more than being absent, absenteeism. And so, have you seen some measures around presenteeism, effective measures of presenteeism?
I have not worked with this specifically recently. I would have to perhaps get back on specifics on this measure. I'm happy to get back to that specific individual with some suggestions there. What I have seen is, because there's also, we need to broaden this question a bit, because one of the challenges that organizations also have sometimes is, and it perhaps ties to my point about scope, is that we are not using what we have efficiently and try to get even more. So we're not necessarily using what we already have, like short-term disability, long-term disability, casual absences. Lots of organizations have a hard time even getting this, right? And getting the specifics of which diagnostic you have there. If you only worked with what you have, you already would have lots to do most of the time. And one of the challenges sometimes people run in is doing too many surveys, too many questions to their employees. They get tired, they don't get response rates. So one of the things to be careful of is what measures do you already have, and are you fully using them first? Most of the time, organizations will be doing employee engagement surveys that are broader and will have indicators that are tied to presenteeism in there, and that may be worth using, because if you add more measures, sometimes you're just not going to get that much more information. So that's also something to keep in mind, but I can get back specifically with these kinds of measures.
It's interesting because when you're looking at some of the measures that we've been discussing are really looking at indicators of mental illness, and it's a mental health strategy. And I think what we're also, it's not just focused about, there's lots of different metaphors or models of mental health and distinguishing between mental health and mental illness. But I think that a mental health strategy is likely trying to not only support people with mental illness, but also support everyone's positive mental health. And, and supporting mental health might not show up in short-term or long-term disability changes in that. So it's an interesting question to try and to look at in terms of, again, prevention and supporting people who are, moving on a continuum that might not be from clinical to well, but maybe from just, poor mental health to positive mental health.
Yes, it's such a great point. It is a very important point. In designing any mental health strategy, I've spoken earlier about the 3 areas of health. You want to link it to that: physical, mental, financial. You also want absolutely to think about it on a continuum of those that are already right now healthy and well, and we want to maintain that. And then you have the groups, and it could happen to any of us. That's we often hear about the 4 in 5 Canadians, but really mental health is for all of us, and that's one of the things we're hearing with the Bell It's Talk Day that's coming. Good reminder. Point is, we'll always have in our population some people who right now are in great mental health shape. Great, we want to maintain that and make it as strong as possible. We'll also have individuals that perhaps are showing signs of presenteeism, or sometimes will be called at risk. So they are at work, they're struggling, however. And it may then show in terms of presenteeism, but it just could be possibly going on disability, right? So having things that will support everyone's mental health, and then if the individuals say do go on disability, things to support them when they come back, right? So we have a successful return to work. So all this is very important. And the most successful organizations will be able to catch individuals close, while they're well or as they become at risk, so that we can support them early in the process, at times avoiding having to go on disability, or going into it but with a less severe state than they otherwise would have. And the reason why we want to avoid this is, one of the things we know, and I know some of you on the call already know this, is that work is healthy for us. Doesn't always feel that way perhaps, but work is healthy. And when we are off work on disability for mental health claims, the longer we are off work, the less likely we are to ever come back. So it's much more healthy to ideally do everything we can to stay at work. And if we are going off work, to try to come back as soon as possible, assuming that we are healthy, because then that allows us to get back into what's healthy for us, being good contributors to all parts of our lives.
Right. That's how some organizations are utilizing the 30-day mindfulness challenge. They have it as an early intervention tool. So if anybody is at risk or going off work or trying to return to work, it's a readily available tool that they can make available for those individuals.
And we know from research that it's effective, so it's good.
Yeah. And I wanted to ask you about any experience in the manufacturing environment. We had a question, would a mental health strategy need to be different for a manufacturing environment, and any tips?
It would have to be different for any organization. Each organization is unique. So some of the things that are unique to, say, a manufacturing organization, sometimes will, and if you look at the 13 factors of the national standard, one of the factors there involves having some kind of balance, which sometimes will involve flexibility and hours and that kind of thing. And then often people will say, well, in our workplace, this is something that's actually hard or impossible to do. And so and I've heard specific examples from manufacturing, so I'll say this, but I actually do think it applies to any organization. What they've done there is they've asked employees, come up with ideas. Tell us the kinds of things that would make you as an employee feel like you have even more balance, that you're even more engaged with the workplace, that you find that your workload is even more manageable. So, and I'm just running through some of the factors from the national standard here, but if it feels like in your workplace or in your industry, some things are a bit tougher, ask people. They will tell you. They will have ideas that on your own you probably may not have thought about. More heads always better than one, and great creative ideas have happened that way. The other, sometimes, not always, but sometimes manufacturing is also associated with more male-dominated industry. Not always the case, but sometimes it is. So there too, there's been fabulous steps moving forward with just asking people to be involved. Give you an example. It's not manufacturing, but it's male-dominated. NAV Canada. They've been very public talking about, and I know they work with different groups. They've been very public. They've won awards as an organization. And NAV Canada, for those who don't know, they work with air traffic controllers in various roles that are all 300 Canadian airports. So the large ones, but also the very small ones. It is a male-dominated organization, and in that organization, strong commitment to mental health over many, many years, and very successful in looking at measures like short-term disability, long-term disability, and decreasing these rates related to mental health over time in the context of their mental health strategy. So it's, I would say, any organization is unique.
Yeah, well, that's interesting. I mean, two points come up for me. One, you just mentioned NAV Canada, and we've just been speaking with NAV Canada, and just working on a contract to implement the 30-day mindfulness challenge. So they've brought on our programming as part of their mental health strategy. It's one of their programs that's fitting in as one of their initiatives of their mental health strategy. So that's interesting to hear you mention them. And you mentioned other male-dominated areas, and we did this interesting project with the Movember Foundation, the mustache people, and it was really one of our roots of moving forward in our work. And how the question was, how do we make mindfulness more relevant and accessible to men? How do we meet men where they are? And because men might not be interested in mindfulness, and doing a multi-week in-person training wasn't going to catch their attention. So we did this whole project learning about how could we engage men in this training on in mindfulness. And that was actually how we first thought about the development of the 30-day mindfulness challenge. We had men in mind, busy working professionals, and if we could capture them, then they would be a more difficult population to reach. And so just an example of how we customized it for that type of a group.
Yeah, great.
So we've only got a few minutes left together, and I was gonna see if there is maybe I'll just ask you in terms of a next step, as a closing, how would you see an organization, how do they figure out their next steps?
Yes. Yeah. Well, of course, you'll guess I'm going to start with it depends. It depends which steps you've taken so far, obviously, but just like any strategy, again, right? Keep in mind, whatever strategy you've done before in any other area, whether it's your personal career strategy or other strategies within your organization, they are alive, right? They're not something that you design once and you follow forever and that's it, right? So in terms of figuring out next steps, if you have not taken many steps yet, then it's a first step. In this case, it could be, if it was me, I'd probably say, use one of those audit tools, the short 3-minute one, if you'd like to start somewhere very manageable and friendly, or bigger ones to get a sense, right? So initially, that's what you would do. If you've been already doing some things, you're like, wow, what do we do next? Then I would say it's time to revisit the strategy as you had it, or the actions you've been taking so far, because many organizations did not start with a strategy. They started with actions. Maybe it is time for you to actually pull this together, harvest what you have and then create your strategy. And strategy needs to have those measurements in. Right? So therefore, if you've been measuring a bit what you've done, and even if you haven't, maybe go back and try to see if you can find ways to assess how things have been, with perhaps a reminder to moving forward, absolutely measure, then these measurements will guide your next actions, right? So you want that. And I would say also, not only this strategy here is alive, but your organization's strategy is alive also, your business strategy, right? And therefore, when you're looking at your next steps, again, bring this one in. So you're looking at everything together to best design what should happen next.
I know you mentioned one tool, a very brief tool. Maybe this is that response answers this question, but I'm going to ask it anyways. Is there an existing action planning tool for working with leaders that would encourage them to reflect on their strengths, identify existing supports or resources, and set SMART goals around the 13 psychological factors? So
for that, yeah, this one is a bit more specific. The short one, the 3-minute tool, it is action oriented, but shorter, obviously, and a bit more concise. So it's a good start, even if you're even if you know you're going to do something more complex. I would almost encourage you to have a look, because it sort of gets your mind thinking about this in a way that's useful. But in terms of more specifics, Mental Health Commission of Canada, lots of resources there. Not only they have their audit tool, but they'll have suggestions also of what to do, types of actions to consider. So that's where I would point you towards.
Thank you so much, Marie-Hélène. I'm going to just wrap up with a few closing thoughts, and then I'll come back and I'll give you any final words you'd like to share with our audience before we close. So I want to thank everybody for joining us today. And I just want to remind you that within a few days, you're going to get another email from us with a link with a recording of this broadcast. And you'll be able to make that available to anybody in your organization that you think would benefit. So please feel free to share that around. As well, you'll get an opportunity to register for the 30-day mindfulness challenge for free. So if you haven't had an opportunity to check that out, it's an opportunity to see what it's all about, and we'd be happy to get your feedback and talk to you about how that might be a quick and easy way to trial a intervention in your organization and get some feedback that you can then use moving forward in a mental health strategy. Also, just to remind you that we host these monthly webinars. We've actually had 2 amazing webinars this month. It was a special month of January 2018. We're looking forward to next month in February to have Dr. Elizabeth Drance from University of British Columbia, who's going to be talking about mindfulness skills in dementia caregiving for both care partners and why they both benefit. So we look forward to that. And if that's of interest to you, there will also be a link on that email that we send around to you tomorrow. So we're going to do our best to take as many of the resources that Marie-Hélène has shared with us today and put it up on our website within that link that we share with you. We thank you again for your engagement, your participation, your commitment to mental health in your organization, and want to pass it back to Marie-Hélène for any final words she may have for us today.
Well, at first, let me echo your thanks to this audience for being there, staying with us the whole time, and those fabulous questions that made the conversation, anyway, at least for me, even more interesting. So thank you for that. I think 3 main things, if we go high level in terms of key things as we do mental health strategy, would be, number 1, we want to think broader. So overall health, physical, mental, financial, all together, because there will be synergies and ways to get even more from that investment. You do want to think continuum from, well, at risk, off work, returning to work. That's also fairly critical. Second thing, you want to make sure you're measuring. And if you have not measured so far, fine. Try to see what you've got, but measure moving forward, because that's possibly the strongest argument you'll have, right? Your measurements. And finally, remember to link all this with your business strategy. So, because that's how you're going to get something that's integrated and makes sense for the business.
Thank you so much, Marie-Hélène. Thank you for joining us, for sharing all your experience and wisdom, and for all the work that you've done supporting mental health into the workplace. We'll see everybody again soon. Thank you.